Having a population in good health is not only good for society, it's also good for the economy. And that's just some of the benefits of having a sound and functioning universal healthcare system. This year's BHF conference focused specifically on issues relating to universal healthcare on the continent, its benefits and challenges, as well as costs and international best practices. The fate of Obamacare in the US, its lessons and implications has also put the issue firmly on the continent's discourse.
I think that universal health coverage is a possibility for any country in the world. And in fact, as we know now, not even the richest countries have full coverage regarding all the three parameters that are included in universal health coverage.
South Africa's national health insurance aims to give universal coverage to all citizens. It's certainly ambitious, as well as perhaps one of the sector's biggest ever reforms.
As universal health coverage, we need to make sure that more people have access to healthcare. We currently have a dual health system in South Africa where you have a public health system that's completely sponsored and funded by the government. And then you have a private sector that is out-of-pocket payments and medical schemes and health insurance processes manage that environment. And that environment covers about 16% of the population. So you can understand there's a large number of people that are dependent on the public sector.
Many of those will have to make use of state institutions, clogging up resources and effectively straining the entire system. It's not ideal, and that's why change is needed. In fact, some healthcare experts believe the entire health model in the country needs to be remodeled, but there's still a long road until any implementation. South Africa's national health insurance may be in its planning phases, but the government is determined to roll it out in the future. It will also have to reach consensus with private healthcare providers.
There has to be better working between the private funders and government in ensuring that the universal healthcare is ultimately achieved. So I think the conference as it is trying to achieve that. It's trying to achieve a better working relationship between the policymakers, government and the healthcare funder.
For now, robust debate continues around universal healthcare, but consensus around the gap between the select few who receive it and the masses that don't seem to be getting narrower by the day. Travers, CGTN, Cape Town.